Good afternoon, everyone. Welcome to the Title V Competitive SRAE New Grantee Orientation Webinar. At this time, I would like to welcome Debbie Powell, Acting Associate Commissioner with Family and Youth Services Bureau.
Hello, I'm Debbie Powell, and I serve as the Deputy Associate Commissioner and the Acting Associate Commissioner for the Family and Youth Services Bureau, or FYSB. We lie at the Administration for Children and Families, and I provide senior leadership for 3 FYSB grant programs, one of which is the Adolescent Pregnancy Prevention Programs, also known as the APP program. On behalf of FYSB, and specifically the Division of Optimal Adolescent Development, where the APP programs are administered, we welcome you and are excited that you have joined us virtually for orientation for the new FY21 grantees. We are appreciative of your commitment to implement effective personal responsibility education programs and sexual risk avoidance education prevention services throughout the United States and U.S. territories. We acknowledge the challenges of delivering services during a pandemic. However, we are very happy and proud that grantees have continued to reach hundreds of young people given this monumental barrier. Many of you have proven to be tremendous leaders and advocates who have advanced FYSB's understanding and programming in the field. We are very proud to call you partners. I'd like to thank all of you for your hard work and your diligence in responding to our APP Notice of Funding Opportunity announcement in July, and commend you on submitting such thorough and well-developed applications. And it goes without saying, congratulations, not only on your successful applications, but in your commitment to foster the growth and success of at-risk youth in your communities. I'm very pleased to say that FYSB awarded a total of $52 million in SRAE and PrEP grants to 89 organizations that work every day to prevent adolescent pregnancy, and for some, to prevent sexually transmitted infections, including HIV and AIDS. We can't wait to see and help foster your success in providing effective adolescent pregnancy prevention programming to help prepare youth for a brighter future. Of course, you're already familiar with the APP program as evidenced by those applications, but today's orientation provides the opportunity to look closely at the inner workings of the legislation, the processes and practices for properly managing your grant, and the resources available to help you do so. There will be a lot of information thrown at you provided today, and it's essential for you to understand how and where it factors into your work. So get comfortable, be engaged, and ready for our question and answer period at the end of the presentation. Let me share a little bit of what will be presented to you during this orientation. We will introduce you to our awesome FYSB staff. We will provide an overview of FYSB and the APP programs and requirements. We will review the guiding legislation for your work, introduce you to training and technical assistance resources and partners, present an overview of the role of the Grants Office and resources that are available to grantees. Plus, we will show you some of the readily available tools and resources at your disposal, like the Exchange, which is an awesome interactive activation platform for APP grantees, partners, and stakeholders to help increase the visibility and impact of your efforts to prevent pregnancy among our most vulnerable youth. And last but certainly not least, the We Think Twice campaign, designed to promote healthy relationships, goal setting, and empowerment among youth. You'll also learn about the support that our team provides for building data capacity and local evaluations. We highly encourage you to conduct continuous quality improvement and local evaluations that will further our understanding of the anticipated outcomes and impact of your projects, and to demonstrate our projects effective. Once again, I am very happy to welcome you to the APP program. And remember, FISBE is always here to provide you the assistance, the guidance, the resources, and support you need to be successful in all aspects of your programs. Once again, congratulations, good luck, and thank you for your continued commitment to our youth.
Thank you, Debbie. And at this time, I am pleased to turn this over to Letitia Winston, Federal Project Officer.
Good afternoon, everyone. My name is Letitia Winston. We want to thank Debbie for the warm welcome. And as she explained, we have a robust agenda for today. We will provide critical information to support you to be successful and make sure that your implementation of CSRAE projects across the nation will be successful. I am Letitia Winston again. I'm the Federal Project Officer with APP, and I'm the APP Program Office Lead for the Title V Competitive Sexual Risk Avoidance Education Program. And again, we welcome you to the new grantee orientation. At this time, I want to introduce our staff. First is our leadership team. Debbie Powell is the Acting Associate Commissioner for FISBE. Courtney Gaskins serves as the Director of the Division of Optimal Adolescent Development, which the APP program falls under. And Labrita White serves as a program manager within APP. In that wonderful staff that Debbie mentioned, I will introduce you to the federal project officers within the Adolescent Pregnancy Prevention Program. Our project officers include Renee Martin, Patrice Moss, Tanya Matthews, myself, Jessica Johnson, Christine Zakor, Katie Derrick, Ricky Richard, Latonia Coriat, Megan Hill, and Alexandria Washington. Our program is also supported by Tarshika Thompson, who serves as the executive assistant, and Owen Burns, who serves as the communications manager. The Family and Youth Services Bureau, or FISBE, is located within the U.S. Department of Health and Human Services Administration on Children, Youth, and Families. There are 4 divisions within FISBE, and the Adolescent Pregnancy Prevention Program falls within the Division of Optimal Adolescent Development. The mission of the Family and Youth Services Bureau is to support organizations and communities that work every day to put an end to youth homelessness, adolescent pregnancy, and domestic violence. FISBE's vision is a future in which all of the nation's youth, individuals, and families, no matter what challenges they may face, can live healthy, productive, and violence-free lives. APP supports state, tribal, and community efforts to prevent teen pregnancy and the spread of STIs through the administration of PrEP and SRAE programs. Programs within APP target vulnerable youth, including youth in foster care and that are justice involved. Sexual risk avoidance education programs implement evidence-based approaches that align with the needs and desired outcomes for youth and teach the benefits associated with self-regulation, success sequencing for poverty prevention, healthy relationships, goal setting, and resisting sexual coercion and dating violence, and other youth risk behaviors, such as underage drinking or illicit drug use, without normalizing teen sexual behavior. The APP program has 7 funding streams and currently has awarded 275 grantees with funds to prevent teen pregnancy and reduce risky teen behavior. We'll now review the purpose and the program requirements for the SRAE program. The Title V SRAE program is authorized and funded by Section 510 of the Social Security Act. It is critical that grantees ensure that all programming complies with the mandated requirements to include exclusive implementation of education and sexual risk avoidance, defined as voluntarily refraining from non-marital sexual activity. Other legislative mandates require that your program use medically accurate information and implement evidence-based approaches that meet the needs and desired outcomes for youth. The Title V CSRAE funds local organizations and entities within states that did not apply for the Title V state SRAE program to implement education exclusively on sexual risk avoidance that teaches participants to voluntarily refrain from sexual activity. The organizations and entities in the list above were eligible for the FY 2021 funding. The goal of the CSRAE program is to provide messages to youth that normalize the optimal health behavior of avoiding non-marital sexual activity. The objectives of the CSRAE program are to implement curricula that includes medically accurate information referenced in peer-reviewed publications by educational, scientific, governmental, and/or health organizations. Also, to select sexual risk avoidance curricula and/or strategies with an evidence-based approach to integrate research findings with practical implementation that align with the needs and desired outcomes of the targeted population. Thirdly, to teach risk avoidance skills through methods that do not normalize teen sexual activity. And lastly, to target youth ages 10 to 19. All CSRAE programs must meet the following requirements. They must teach medically accurate, culturally and age-appropriate information, use evidence-based interventions and strategies, use positive youth development in its framework, target the appropriate population, provide appropriate referrals to health and health care and other services, conduct research and evaluation, potentially participate in a national evaluation, and then also collect and report performance measures. The Title V CSRAE programs must provide information that's medically accurate and complete. Medical information must be verified or supported by the weight of research. Program materials such as text, supplements, workbooks, videos, flyers, handouts, posters, or flashcards should be reviewed in comparison to current medical statements of fact in accordance with the most up-to-date scientifically supported information. All programs must be age appropriate, which means that the topics, messages, and teaching methods implemented by the project must be consistent with the developmental and social maturity of the program participants. CSRAE programs must at a minimum implement evidence-based programming. Selected interventions must be promising practices or have evidence of effectiveness with the target populations and adhere to the following requirements. Again, must be medically accurate and complete, must be age appropriate with regard to the developmental stage of the intended audience, and also be culturally appropriate, recognizing that the experiences of our youth from diverse communities, backgrounds, and experience should be considered. Per the SRAE legislation, all programs are required to follow the A through F topics as outlined. CSRAE programs must include positive youth development as part of any risk avoidance strategies to help participants build healthy life skills and protective factors that mitigate the impact of past and future negative factors. Number two, empower participants to make healthy decisions. Thirdly, to provide tools and resources to prevent pregnancy and STIs. And lastly, to prevent youth engagement in other risky behaviors. The program approach must also include service linkages to local community partners that support the safety and well-being of the target population. The Title V CSRAE programs may only provide education to youth on sexual risk avoidance. Funds may not be used to provide separate services such as healthcare, educational, career development, or counseling services. However, programs should encourage youth and their parents to enroll in assistant programs. SRAE curriculum requirements. The curriculum selected must be age appropriate with regard to the developmental stage of the intended audience, culturally and linguistically appropriate, exclusive in its purpose to teach sexual risk avoidance and the benefits associated with self-regulation, success sequencing for poverty prevention, healthy relationships, goal setting, resisting sexual coercion, dating violence, and other youth risk behaviors, such as underage drinking or illicit drug use, without normalizing sexual activity. The interventions, materials, and curricula must not promote or encourage sexual activity outside of marriage. And the curricular interventions and activities can provide information on contraception that does not include demonstrations and/or simulations of contraceptive devices. All SRAE programs are to be implemented with fidelity. Grantees are to implement strategies to ensure that programs are implemented without compromising the core elements of the curriculum that have been identified as essential for achieving program effectiveness. We're now going to review the medical accuracy review process. Here's the definition of medically accurate as stated in the legislation and the NOFO. What is key is to ensure that the information provided to youth is both verified and supported by scientific research. Medical accuracy reviews are important because medical information is constantly evolving, and as new discoveries are made, program materials can become outdated. Additionally, medical accuracy reviews ensure that program materials are accurate, complete, and up to date when they're shared with the youth. Issues that are addressed in the review are typically related to information that is inaccurate, incomplete, outdated, poorly referenced or supported by non-scientific studies, confusing or misleading, and/or contradictory to the program requirements. Grantees should conduct an initial review of the program materials for medical accuracy prior to submitting to FISBE and our contractors. If using program materials that can be modified, issues found should be corrected prior to submission. Additionally, grantees are encouraged to independently review materials on a regular basis and make updates as necessary. Based on past experience, we have noted during the review process that some grantees opt to select alternate curricula to ensure that the intervention fully conforms to the program requirements and includes medically accurate information. Reviewing the curricula and all other program materials carefully prior to the program implementation may make a difference in the interventions you ultimately choose to use in your project. For example, if you discover that there are major issues throughout the program materials and they require considerable modifications, you may need to consult with your federal project officer to explore the use of other curricula. Grantees are to submit materials to FISBE. Grantees are to respond to and address inaccuracies using various methods to include making modifications to the actual curriculum text, creating an insert with updated information, selecting a different or supplemental brochure, video, or handout, and consulting with the developer on any significant changes in the curriculum. We will soon host a medical accuracy review webinar to provide more detailed information on the process and instructions on how to submit materials. If you have any questions prior to the medical accuracy review specific webinar, please consult with your assigned project officer. We'll now discuss the roles and responsibilities of the APP Program Office. The Program Office reviews applications and programmatic reports, responds to programmatic and technical aspects of the grant, ensures the amounts to be awarded to grantees are consistent with current statutory requirements, and monitors grantee performance. Project officers are the contact person for any programmatic changes or updates. Below are examples of their duties and when you should contact your project officer. Technical assistance may be provided in a number of different formats and platforms, including emails, webinars, conference calls, virtual meetings, and site visits. Grantee site visits and monitoring are essential to the responsibilities of the project officers. Your project officer will discuss the scheduling of site visits with grantees in the future. The objectives of those visits are to ensure compliance with terms and conditions of the grant and authorizing legislation, to discuss program implementation and observe a program activity, and also to provide technical assistance on areas related to the programs. I will now turn it over to our colleague in the Office of Grants Management, Bernard Morgan, who will provide you with more information on the fiscal management of your grant.
Hello, I'm sorry, my camera seems to stop working. My name is Bernard Morgan. I'm one of the grants management specialists for the Office of Grants Management. Just going to go over a few things with you regarding the Office of Grants Management, our role, and what we do to support you in your goals and objectives. The role of the Grants Management Offices is to help you with your fiscal management and administration of your grant award. We ensure compliance with applicable laws, regulations, policies, and procedures, and technical aspects of the grants and fiscal monitoring. We provide guidance on fiscal requirements related to your grant awards, terms and conditions of the awards, and any post-award changes, reporting, and eventually closeout procedures. You should contact OGM, the Office of Grants Management, for the following things: requesting amendments to the original grant application, such as changes in key personnel, budget modification, carryovers, and no-cost extensions. Just a caveat to that, you should also contact your program officer so that we can work together to make sure that what you're requesting is in line with your grant award, as well as the applicable regulations. You should contact OGM for any clarification of budget issues, particularly allowable costs, and any guidance on submitting fiscal reports and other official correspondence. Payment Management Services, or PMS, is part of the HHS Program Support Center, which is separate from ACF. PMS provides the payment and accounting system for all HHS grants. Grantees are responsible for requesting payments and reporting disbursements to the payment management system. Grantees must spend funds within 72 hours after requesting drawdown. That means you're requesting drawdowns for immediate expenditures, not to draw down and then pay later, but for immediate expenditures. Next slide, please. Payment Management System, or PMS, requires quarterly reporting via the Payment Management System. The quarterly reporting is the FCTR, or your Federal Cash Transaction Report. This is separate from the other report that you're required to do semi-annually, or the Financial Status Report. You can visit the PMS website for quarterly FFR due dates and find your PMS account contact info for PMS access assistance or any drawdown questions. The PMS phone number is also there. The PMS website itself has a lot of guidelines, user guide, and other resources that would help you in using their system. Submission of federal financial status reports and program progress reports. We are going to go over the due dates, so you don't necessarily have to go searching for them. You'll see them right here in the next couple slides. Next slide, please. So first you have your performance progress report, or your PPR. The program progress reports are due semi-annually. So that's every 6 months. You have a 30-day, so it covers a 6-month period, and then you have 30 days after that 6-month period is when it's due. You submit reports to the grant notes via Grant Solutions, and PPRs are due, as I said, 30 days after the end of the period. For the project period, you can see the dates stated here. If your program started on 9/30/2021 and ends on 9/29/2022, your first report is not due until April 30th, 2022. This covers the first 6 months, as seen here, September 30th to March 31st. The second report covers the second 6 months and is due on 10/31/2022. Program indicators include major activities and accomplishments during this period. Any challenges you may have encountered, any significant findings or observations, organizational issues, TA and training updates, activities planned for the next reporting period. All of these indicators are essential for both the program officer and for the Office of Grants Management to ensure that you are meeting your goals and objectives and to make sure there are no challenges that would prevent you from meeting those goals and objectives. Next slide, please. Your federal financial report, or the SF-425, the FFR and FSR must be completed and submitted through payment management system. This report is in addition, the FSR is in addition to the quarterly FFR with PMS, which I mentioned earlier. It's also called the FCTR, the Financial Cash Transaction Report, or the FSR, which you see here is the Financial Status Report. So if you hear those terms, you'll understand which one is the quarterly and which one is the semi-annual. So it's the exact same SF-425, just different sections of that form that you're completing. As we're saying, SF-425 is due semi-annually and annually. The annual one is due 90 days after the end of the budget period. The budget period ends on 9/29, so you'll be submitting the annual one on we have December 30th. It just gives you a little bit of coverage. But it's due, but the second semi-annual is due 30 days after the end of reporting period or after the end of the budget period. For the project period, you can see the dates here. Once again, it starts on 9/30/2021 and ends on 9/29/2022. You can use these dates as guidelines. The reports are typically due at the same time every year. So the PPR and the FSR are going to be due at the same time. So if one's due, the other one's due. So your first report is due 4/30/2022. Second report due 10/30/2022, annual report due 12/30/2022. The SF-428 report. This is regarding any tangible. It's the tangible property report. It's example for equipment and supplies. Has 3 parts: an annual report, a final report that's submitted at closeout, and a disposition request report. That's if you have anything to report. It has to be submitted along with the cover page for the SF-428. Annual reporting required, it's no longer specifically required annually, but it could be under these awards. I will double check and let you know, but at this time it is not required. But you will, if you do have to require, if it ends up being required annually, you would submit it as a grant note in Grant Solutions. But I will get back to you guys on that to ensure if it is or if it isn't. Grant Solutions. Everything happens in Grant Solutions. This is the repository for all things that are associated with your grant award. The first thing we're going to go over are the user roles. Only the authorizing official or AO and the PD, project director roles in Grant Solutions have access to make any requests or upload documents. Other roles have read-only access. OGM is responsible for ensuring that the AO and PD for grants have access to Grant Solutions, and you can direct any questions regarding these roles to your assigned grants management specialist. There are 6 supporting roles that you can request, but you would go straight to the Grant Solutions help desk to request those roles. Any updates or changes to the AO or the PD, you would contact your assigned grants management specialist and your project officer so that we can ensure that you have the right documents together to make sure that change does occur. Grantees control your submission of post-award amendments, which we'll talk about shortly. And you can contact OGM with any questions regarding these user roles or anything within Grant Solutions. So these are some of the post-award changes that require prior approval. As I like to say with new grantees, any post-award changes you come up with, it is best to discuss them first with your program officer and your grants management specialist to ensure that they are within the scope and objectives of your grant award and that you have the ability to make those changes. So as you see here, a change in scope, change in key personnel, transfer of funds from the approved budget, no cost extensions. No cost extensions are only at the end of the project period, but we'll talk about that a little bit more in a second. Significant rebudgeting and need for additional funds. So budget modifications or significant rebudgeting are one of the more frequently brought up situations for grantees regarding post-award amendments. You would submit your request as an amendment via Grant Solutions. The required documents include the cover letter signed by the authorizing official, the SF-424 signed by the authorizing official, the revised SF-424A, and a revised budget line item, budget justification, and other supporting documents to justify your request. Significant rebudgeting is considered 25% of your project cost or $250,000, whichever is lower, depending on your award. So if your award is not at $250,000, it would be 25% of your total project costs. If it's over $250,000, whichever one comes up first. You can visit Grant Solutions training videos for instructions on post-award amendment submission at the link seen here. And once again, this is one of those things where you have the flexibility to make changes if it falls below the 25% or the 250,000 guideline. But it's one of those things where you want to check in with your project officer and your grants management specialist to ensure that any changes that you are proposing or prepared to make are still in line with the scope of the project, are allowable, and are allocable to the grant award. So even if you have flexibility, which you do if it's under 25%, please make sure that you consult with your project officer and your grants management specialist before going forward with those changes. Carryover of unobligated balances. This is another one that could come up. These funds are to be used to complete unfinished activities from the prior year, and the cost should have been reflected in the approved prior year budget. Carryover balances should be requested as soon as possible after the submission of the annual financial status report. That's the one that's submitted 90 days after the end of the budget period. So the one that's submitted on 12/30, after you've submitted that annual report, once you have the accurate accounting for what is unobligated from the prior budget period, that is when you submit your carryover request. And this must be submitted via managed amendment in Grant Solutions. The required documents are, once again, the cover letter signed by your authorizing official, SF-424, signed by the authorizing official, SF-424A, your line item budget and budget justification showing the carryover amount only. That's all we're concerned about, the carryover amount. And your annual FSR, SF-425, showing your unobligated balance on line 10H. No cost extensions. No cost extensions are requested to complete activities of the grant in the final year of the project period. Requests are not approved merely for the purpose of using unobligated balances or just trying to spend down funds because you have them available. Requests should be made 45 days prior to the end of the project period and are a one-time extension up to 12 months. Please, if this does come up in the final year of your project, make sure it is done 45 days prior to the end of the project period. That gives us enough time to review it and to approve it and to issue it. If it comes less than that, it's harder for us to make sure that things are issued to you in a timely manner. The no-cost extension does not authorize additional spending or any new activities beyond the purposes consistent with the original award. Remember, the no-cost extension is not additional funds. It is just additional time to complete the activities that were approved for the grant award. Follow the instructions in Grant Solutions for requesting a no-cost extension. When you go into managed amendments, the required documents will show up, and there are instructions within Grant Solutions to assist you with these post-award changes. But once again, for the no-cost extension, you're only required to have the SF-424 cover letter explaining the revised expiration date that you're proposing, supporting reasons for the request, and your remaining balance. All SF-425s and PPRs from previous and current budget periods must be on file. If they are not on file, this could prevent us from granting you that no-cost extension. So please ensure that all reporting is done. This could also affect your ability to draw down. So that's another great reason to make sure that all your reports are submitted within the systems. I will now be turning it over to my colleague, Mr. Jerry Rieger.
Thank you, Bernard. My name is Jerry Regier, and I am the director of the SRAE Performance Measures contract. And I will go over a couple of slides here. Next slide, please. The purpose of performance measures is to monitor program implementation and progress, to provide timely feedback to grantees for ongoing program improvement, and to report to FISB, ACF, and HHS leadership. Next slide, please. The benefits of the SRAE performance measures, the benefits to the grantees are that it arms you with data that you can share with stakeholders, and you can facilitate monitoring and continuous quality improvement by monitoring progress toward program goals and identify training and technical assistance needs. And that data is all available at the dashboard for the performance measures effort. And then finally, to provide data to advocate for your own continued additional funding and sustainability. I'm going to turn the rest of this presentation over to our subcontractor, Laura Hulsey from Mathematica. She directs the subcontract for this performance measures. Laura.
Thank you, Jerry. The next slide highlights some differences between performance measures and evaluation. Performance management, as shown in the first column of this table, examines inputs, outputs, and outcomes. Inputs are the resources that make the program possible, such as the amount of funding, the number and types of staff, and the curricula used. Outputs are the direct, tangible products, such as the number of youth who participate and the number of hours of programming provided. Outcomes are the status of participants after services, such as participants' perceptions of the program's influence on their behaviors. Impact evaluation, as shown in the second column here, measures the difference in the outcomes for participants and the outcomes for a comparison or control group that did not receive services. This contrast between participants and non-participants can establish a causal relationship between the program and its impacts. The SRA performance measures fall into three broad categories. Measures of attendance, reach, and dosage describe the delivery of the SRAE programs, including the numbers of participants, the settings in which they are served, and how much of the programming they attend. Measures of structure, cost, and support for program implementation include the features of the SRA programs, such as the curricula implemented and topics covered, staffing patterns and training, and funding. This category also includes providers' perceptions of implementation challenges and technical assistance needs. The final category of measures is participants' characteristics, behaviors, program experiences, and perceptions of program effects. Grantees will collect these participant-level measures through surveys administered to youth at entry and exit of the program. There are separate versions of the participant entry and exit surveys for middle school youth and for older youth. The middle school versions of the surveys contain a subset of the items in the high school and older versions. In particular, the middle school versions do not include questions about sexual behaviors. As shown in the table, the frequency of data submission and reporting periods vary by category of performance measure. Measures shown on the first two rows, attendance, reach, and dosage, and participant characteristics, experiences, and perceptions, are submitted twice a year, each winter and summer, with each round of submission covering the previous 6 months of programming. So, for example, during the summer 2022 data submission, grantees will submit data covering January through June 2022. In contrast, the measures of structure, cost, and support for program implementation, shown on the last row, are only submitted once a year. They are all submitted in the summer, and those measures cover a full grant year from October through September. So this next time you'll be submitting structure, cost, and support measures, you will be submitting measures covering your first year and they will be submitted in that July and August 2022 period, along with all the other measures. So for new grantees here on the call, this July-August 2022 period will be the first time that you submit the performance measures for your new SRAE grants. We have planned a series of training events that will provide more details about the SRAE performance measures and guidance on related topics. The first webinar is scheduled for next Wednesday, November 10th, and will focus on the revised participant entry and exit survey measures. Following that live webinar, we will post 2 recorded webinars, one on working with partners and institutional review boards, and one about collecting survey data online for grantees interested in using that mode of data collection. On December 9th, we will hold office hours to answer questions that grantees have about any of those topics. And then on January 13th, we'll hold another live webinar about the SRAE Performance Measures portal, which grantees will use to submit the measures to ACF. Invitations to each event will be emailed in advance. Finally, I would like to point you to the SRAE Performance Measures website, www.sraepas.com. There you will find more information on the performance measures, including guidance documents and recordings of past webinars for grantees funded in earlier rounds. However, as you peruse the materials on this website, keep in mind that revisions to the performance measures are currently under review by OMB, and the materials posted now do not yet reflect the revisions. The current versions could still be a useful resource because most revisions are reductions in the measures, so feel free to familiarize yourself with what's on the website while you're waiting for the official revised versions to become available. And now I'm happy to turn the presentation to Susan Zief.
Thank you, Laura. Hi, I'm Susan Zief, and I am the project director for the SRAE National Evaluation, which we refer to as SERENE. This is a partnership between Mathematica and Public Strategies, just like the performance measures contract that you just heard from. So I'm going to provide an overview of the evaluation today. It's going to provide a very brief overview of the national evaluation. Importantly, at the end, I'm going to summarize ways in which grantees can be involved in the coming year, and also make sure you have our contact information so that you can get in touch with us directly. So there are 3 main efforts part of the national evaluation. We call them the National Descriptive Study, the Program Components Impact Study, and Data and Evaluation Support. They have been designed to kind of be integrative and inform each other. And all of these efforts support broader goals of the national evaluation, which is to produce action-oriented evidence for all of you, the field, to engage with you, experts, and other stakeholders in the field to inform our evaluation activities and to uphold ACF's evaluation priorities as we undertake all of these actions. All right, I'm going to describe the National Descriptive Study. The National Descriptive Study tells the story of SRAE programming nationwide. It began in summer 2020 with grantees who were funded at that time answering a survey about their program plans and activities. We call that the Early Implementation Study. There will be a forthcoming series of briefs very shortly that describe the findings from what we learned about program plans. The next phase will be a data collection happening about a year from now. In that phase, we are seeking to understand grantee program implementation experiences and lessons learned. We're also going to quantitatively examine relationships between features of program implementation and outcomes. And this study is conducted across all grantees that are funded at the time we do data collection. The National Descriptive Study is also in a great position to tell the story of COVID programming. Last fall, we administered a brief survey, a kind of a closed-ended survey to really better understand program disruptions during the 2020-2021 school year due to the pandemic. Momentarily in November, we are going to return with more in-depth qualitative interviews. Our sample for this are returning grantees. So if you are newly funded, you will not be part of this data collection effort only because we are asking about, in a more robust way, what happened over the course of last year, what changes had to be made, and what silver linings and what learnings have you brought into your programming for this current year. Okay, these interviews, though, if you are a returning grantee, will be conducted on a virtual platform so that you can participate at your own convenience. Okay, now I'm going to talk about the second arm of the study, the Program Components Impact Study, otherwise known as the CIS. All right, traditionally, program evaluation in this field really is asking the question, does this amorphous black box work? You've seen it a lot in evaluations of particular curricula. Is a particular curricula effective at improving youth outcomes? And you do an impact evaluation and you get a thumbs up or a thumbs down of that program. But there is so much more that goes into delivering services to youth than just the curricula, which is why there is increasingly an interest in studying the components of programs. And that's what we're doing on the national evaluation. So what are program components? Well, they've been defined as essential parts of the program that are irreducible, meaning we've reduced them to the smallest part there could be, that are really considered critical for achieving the program goals. This can be a combination of the curriculum, but also the supplemental activities, who the facilitators are, and the mode of facilitation. So how does studying program components differ from program evaluation? Well, program evaluation, like I said earlier, answers the question, is the program effective? But program components research can answer, why is the program effective? And how can components of programs be improved? And it's that last question, how can components of program be improved, that the national evaluation will focus on. Okay, so for the goals of the CIS is to first identify and then improve components that are important and relevant for the field. So during the identify phase, we met with stakeholders and program experts for the better part of a year to hear from them what they thought were the critical components of delivering an SRAE program. And now we're in the second stage, improve. We are going to study the implementation and outcomes of selected components. So our identify phase pointed us 100% of the time in the direction of beginning with facilitation. This was a strong priority from the field. Stakeholders consistently identified facilitation as being critical to delivering an SRAE message. And the evidence base does not really address facilitation within the context of SRAE, so collectively we can address a key knowledge gap. And of course, this is a core component of all programs. You all have to take that step of facilitating and bringing the content to youth. We've identified 2 facilitation strategies that have gone through a development phase and are ready to be tested. And we are going to begin very shortly to test the feasibility of replicating each of these strategies through a proof of concept pilot. All right, I'm going to briefly describe the 2 strategies. Strategy 1 is using co-regulation when facilitating programs. So the basis of this is that youth need skills in self-regulation to promote positive relationships and avoid risky behaviors. This is in the SRAE legislation itself, and all grantees are expected to address this in their programs. So we will be using, if you focus on the bottom bullet, a set of 6 co-regulation strategies that were previously developed in consultation with grantees and will be helping a small number of programs in this pilot implement these strategies into their facilitation. The second strategy is called Facilitator Foundations, and it's based on the premise that youth behavioral change is not possible without a strong understanding of what predicts behavioral change among the facilitators of the program, and that facilitators can play a really important role in assessing youth progress on these predictors. There are 6 predictors that have been identified as being strongly related to avoiding sexual risk, and they're listed here on the slide. And actually, if you have been a prior grantee, you were introduced to these predictors and how they can be used in the facilitator training during a TTA topical training. All right, so now on to data and evaluation support. There are 2 areas where we provide support. The first is for your local evaluations. We support grantees who conduct high quality, who are conducting descriptive and impact evaluations in the goal of helping you make your evaluation the best it can be. We will meet with you one-on-one and also provide tools and resources that address evaluation design, measures, data collection, analysis, and reporting. If you are planning an impact evaluation, where you would plan to compare outcomes between 2 groups, we will be in touch with you shortly to offer our support. The second way in which we improve the data and evaluation support is through data capacity building. This pertains to all grantees. We're supporting you in using data and research to improve your SRAE programming and outcomes for youth. There are many resources that support improved data capacity building on our website, and many more that will be coming through shortly. So this is relevant to all grantees. Example topics include logic models. A big topic is continuous quality improvement. We had a wonderful pilot with a small number of grantees last year, and we will be releasing a lot of tools and resources to help you build a CQI plan. We focus on implementation evaluation, measuring program costs, and data collection and storage. So a lot of the resources on our website are related to helping improve your ability to use data. And this is what our website looks like. On the home page, which is kind of on the left, you'll see a welcome and recent resources that we've released. And then when you, on the right side of the slide, it shows the resources and webinar page, and you can search for a particular resource by the topic that you're interested in, or you can view all. Okay, so here's a summary of the upcoming activities and opportunities where you may be able to engage with the national evaluation. First, I mentioned the briefs from the first data collection that describes grantee program plans. They will be released shortly on our website, and we will announce that with an email to all grantees. I spoke about the virtual interviews related to how COVID is affecting programming. That will be with returning grantees only who were providing services last year. And then in a year from now, we'll be doing another round of data collection across all grantees to understand program implementation experiences. On the program components impact study, I mentioned that we are about to conduct a small pilot to replicate those 2 strategies I described. And we are currently in a recruitment stage to identify just a small number of grantees that meet the study design criteria that can help us pilot these strategies. We then will be moving to a larger scale impact and implementation study of the 2 strategies, so a great opportunity to be involved there. And we will be We have some formative development work that we're going to continue on each strategy, and there'll be opportunities to participate in that as well. And of course, for our data and evaluation support, we will be conducting some upcoming pilots to improve implementation evaluation. I mentioned that if you're planning an impact evaluation, you can receive individualized support from us. And of course, please contact us directly if you're not hearing from us with any evaluation related or data collection support you may need. This is our contact information. So if you are a new grantee, please do take down our email address and our project website, but you will very shortly be hearing from from us as well as we release those briefs that I mentioned. Thank you. And now I'd like to turn things over to my counterpart on the SRAE National Evaluation from Public Strategies, Jerry Regier, who is going to introduce another support. Jerry?
Thank you, Susan. Yes, my name is Jerry Regier, and I'm the project director of the SRAE Training and Technical Assistance Contract. And this is the contract that is available to all of you as grantees. If you need some assistance with any aspect of your program, you just need to make that request through your federal project officer. And then we have a team of experienced persons in both technical assistance and in the SRAE field that will be available then to contact you and to provide that assistance. This can be anything from recruiting to retention, to facilitator training, just anything that comes up in your program. We want you to know that this is an available resource for you to take advantage of. But again, you do that through contacting your federal project officer. I am at Public Strategies, and we provide this service. We're a culturally and professionally diverse team with headquarters in Oklahoma City and staff in Washington, D.C. area, Colorado, and North Carolina. We have been doing technical assistance for the federal government on a number of different contracts for the past 20-some years. This is the leadership team of the SRAE TTA team. And you will see that task 3 is our individualized technical assistance, and I'll be talking a little bit more about that in a minute. Adrian, and that's Scott Roby. Adrian Selvage and Marianne Mozak provide leadership to the task 5 topical training as co-leads. Michelle Watson is project manager for getting some highlights and profiles of grantees. We keep that on the FISB, keep it updated on the FISB website, and also provide some input into the ACF FISB newsletter. And additional personnel then are persons that provide some of the TA directly. And our subcontractor on this contract is Ascend, and Marianne Mozak and Tracy Pike are 2 of the persons that assist with providing technical assistance, and then we access consultants as needed. And we have other staff at Public Strategies, Azalea, Kirsten, Sheila, and they will assist as well. I'm going to just go over a couple of things that are already being planned that you can make note of. First of all is the topical training that will be a virtual topical training, and this will be 3 half days in the afternoons of February 15, 16, and 17. The topic has not been determined yet. We are working with FISB and they are reviewing some proposed topics, and we should be able to provide that topic in the next several weeks. And then we'll be doing the planning and let you know, and an invitation will come out for you to, as a grantee, send one or two persons to this virtual training. And then I've already mentioned the individualized TA that you can request through your federal project officer. And I'm repeating myself because we want you to really take advantage of this. Sometimes grantees feel like if they ask for TA, it shows that they have some weakness, and that's not it at all. This is free and available to each of you as grantees. This is to help you strengthen areas where you may have some challenges, but it's available, and just request that through your federal project officer. And then there's some offsite TA that we provide as well. We will be doing several tip sheets on critical issues that can be helpful to you. We will be doing some webinars, including this orientation webinar, and some cluster calls, which is an opportunity for a smaller group of grantees to get on a virtual call and interact with each other around a particular topic. And then we also provide some e-updates on trends in the field. And then the last activity that I want to mention is site monitoring, and that was already mentioned at the beginning of this presentation. But once it is determined which grantees will be monitored, then the team from Public Strategies and Ascend will work together with the project officer to work with you as the grantee to develop the materials and do all the planning and who will be interviewed. And this, again, is a virtual opportunity over a period of usually 2 to 3 days. So resources and additional information. For further information, you can contact Public Strategies at that email, srae.tta@publicstrategies.com. And then for additional resources, you can go to the Exchange. Many of the resources that have been provided to grantees over the last several years all reside on the Exchange. So even though you will look forward to what's coming with webinars or topical training over the next months, you can also go to the Exchange and look backwards and find some tremendous resources, which would be our topical trainings over the last several years, and webinars that have been provided, as well as tip sheets that can be helpful to you. And to talk about the Exchange and the website and give you more information on that is Owen Burns from FSBE. Owen.
Thanks, Jerry. Hello, everybody. Hope everyone's having a good afternoon. If we jump to the next slide, there's one little bit of a housekeeping slide for everybody. Ways for you to access TNTA. I'd say probably the primary is just be in contact with your federal project officer. And as a shameless self-promotion for the Exchange, there's always information and resources on the Exchange to help you out as well. The 3 bullets you see here is something I'd like to try and encourage everybody to do as soon as possible after we get off our webinar here, in order to make sure that communications from FSBE and from our partners about the Exchange and about events and overall communications, we'd like you to add all 4 of these domain names to your safe senders list in your email client. I'll try and put these in the chat here when I'm done, so everybody has them at the tip of their fingers. And if you're not familiar with doing that, you can just type a query into your browser or into your email help window, and that'll help you get through it. So I'm going to go ahead and talk about the Exchange for a couple of minutes. And we can go to the next slide. If everybody looks to the bottom right-hand corner of the Zoom window, not the leave button, but the reactions button, give me a show of hands or a thumbs up if you're familiar with the Exchange, if you visited the site. It'll give us a little idea of how many people are seeing the content we've got there. While we see that, even if you haven't, I'd like to encourage everybody to make sure and visit and become familiar with the site because it is, as Jerry had mentioned and as Debbie had mentioned, it's a destination site for TNTA resources and information for all of our grantees. I'm going to go ahead and play a quick video right now. It's about 3 minutes long. So if everyone could just pay a quick attention, if we would go to the next slide.
Are you an adolescent pregnancy prevention or APP grantee receiving funding from the Family and Youth Services Bureau? Do you want to take your teen pregnancy prevention efforts to the next level, but unsure of where to start? The Exchange is the place for you. 3 years ago, we interviewed APP grantees like you about the types of resources and tools they'd like to see on a website to support their programs. A few months later, we launched the Exchange website, which includes resources, an event calendar, blog, comment wall, and a tool that allows you to customize promotional materials. Have a question about human trafficking? Want to find the recording from a webinar you couldn't attend? On our resources page, you can find what you need quickly by using our format and topic filters. Once you select a topic, hover over the image to see the format types like infographics, webinars, podcasts, and online trainings. Want to share a resource with your colleagues and networks? Just select Share to post to your Facebook or Twitter accounts. As APP grantees, you look at teens' health holistically, their relationships, mental health, substance abuse, and physical health. With our event calendar, you will find upcoming adolescent health observances and how to get your program involved. You'll also find the dates and information for in-person trainings, webinars, and conferences offered to APP grantees. Want to create your own infographics, web badges, and tip sheets on teen pregnancy prevention and other adolescent health topics, but don't have time? The Studio tool is your answer. With the Studio, you can add your organization's logo to materials that have already been fact-checked and approved by the Family and Youth Services Bureau. Within minutes, you'll be able to download and share personalized materials to help increase the visibility and impact of your program. To access the Studio tool and other materials developed exclusively for APP grantees, you need to create an account on the Exchange. If you are the primary point of contact for your grant, then you must register before any other project staff can access exclusive content. Each grant can only have one primary contact. Registering takes less than 5 minutes. Just click Register in the top right corner. Select APP Grantee Point of Contact. Then complete the form with your name, grant number, email address, organization, and funding type. Once your account is approved and you set your password, you can add project staff by going to Account and then My Grants. Just enter their names and email addresses, then select Invite, and they'll immediately receive an email granting access to the site's exclusive content. We know you are actively focused on helping youth avoid obstacles to success and prepare them for bright futures. Don't waste time searching the web for resources. Visit the Exchange, your one-stop shop for content and features designed to enhance your APP program.
So if any of you have visited the Exchange in the last week, you'll probably notice a few changes. We've just very recently undergone an infrastructure review and a security review and have, as I mentioned, made a few changes to the site. A lot of it behind the scenes, but a number of the changes have been to the structure and navigation. So there's some differences from what you'll see than what was presented on that video, but it is very intuitive and easy. So I'd encourage everybody to go ahead and visit the site. We just mentioned the resources page. That's one of the most trafficked pages on the site. It's the location where all of those things Jerry mentioned, tip sheets, webinars, recordings are all located. You'll see several filtering options at the top of that page, and that'll help you pinpoint the resources that you're looking for. The video also talked about the event page, and so I won't belabor that point any, but it's where we put our events and health observances and things like that. And so there's a little screenshot of the event calendar there. I think we can go on to the next one. And this is a feature that we have been calling the comment wall. With the infrastructure review I mentioned, one of the things we've done is change the name of this to be called the Grantee Network. And I'd like to give you guys some special encouragement to go ahead and visit this site. It's not actually live right at the moment because of those changes, but it should be coming online in the next couple of days, the Grantee Network. And this is a networking area that's provided for grantees and TNTA providers to share thoughts and stories and successes that they've had with their programming. So we encourage you to go ahead and use that. You may well find yourself able to get new ideas and other things that other folks have done successfully. So, and as far as contacting your TNTA team, we've got obviously the email address here. And I know Jerry and his team are ready and willing and more than able to supply all the TNTA that you guys might require. And we'll jump to the next slide, and I'll introduce you to another web property that the APP program runs. Again, if we could maybe use the reactions button down in the lower right, give me a thumbs up if you guys are familiar with the We Think Twice website or Instagram page. This site is actually specifically built and targeted for youth, and offers our visitors inspiration and motivation, as well as helpful tools that can help them make good decisions and strive for optimal health in their lives. So the goals of the We Think Twice website, you'll hear this term with youth and for youth a number of times, when we're talking about We Think Twice. And what it means is that we have leveraged our audience in designing, building, and informing what goes on the site. So we have input groups that give us ideas, and we use them for testing of the site and a number of other functions. And it helps the site be very, very targeted and appropriate and relevant to that teen audience. I'll give you an example of that. It's something that you may or may not have seen in the last couple of days. Last week, we actually had a Q&A session with a number of our We Think Twice youth and Dr. Anthony Fauci about questions they had about vaccines for teens and youth. We saw a lot of chatter amongst that group and questions. And so we posed the question to Dr. Fauci's office, had a quick Q&A session with him. And so that's on the We Think Twice website and Instagram now. This slide gives you a little bit of an idea of the ecosystem of the exchange. We started out with the Instagram page and then added our website and a Facebook page. We also have the We Think Twice Insiders. That's the sort of closed research group we use of those teens. And you'll also find digital products for youth on the websites, things like quizzes, infographics, contests, giveaways, all things designed, again, to help youth make healthy and wise decisions. And then there's also, in the bottom left corner, you'll notice tools for youth serving professionals. Most often, those are not actually located on the exchange, or rather on the We Think Twice site. They're on the exchange, and so you can use that resource tab to find those as well. So a little bit of shameless self-promotion again here. The metrics for We Think Twice in the top in gray, you'll see Instagram, and then on the bottom is the website. We've had over 13 million post impressions over the life of the campaign, which I believe started in July of 2019. And then obviously website, we've got 104,000 users, a lot of sessions. I can tell you that the Instagram follower population we have has grown over 155% in the last 18 months. So we're having great success with that. And if we go to the next slide, and that growth actually is continuing. So we're really pleased with everything. Here's a little slide about some of the more popular content on the site. On the left are Instagram posts, the top 3 Instagram posts we've had and statistics there. and then some of the top web pages. And these represent some of the tools that I mentioned, tools and resources, Healthy Relationships Quiz, the Perfect Person Quiz, motivational quotes. There's an entire inspiration page on there where the teens can go and look at different artwork, poems, all kinds of things like that. So here is just the ways to connect with the We Think Twice campaign. Obviously, the website and the Instagram and Facebook handles there. I will say if you guys want to encourage your youth to get involved in the campaign, go to the We Think Twice website. You'll find a Take Action page on the home navigation or the main navigation. They can sign up to join the We Think Twice Insiders, and when they do that, they'll be invited to different focus groups and testing activities and sharing sessions. And there are actually some incentives that are provided when they're asked to take part in some of that work. And I believe that is the end of my presentation. That's the end of my presentation. Go to the Take Action page right here. And so I'm now actually going to pass this off to Labrita White, who is a program manager with APP.
Awesome. Thank you so much, Owen. And good afternoon, everyone. Specifically, good afternoon to our Title V Competitive Sexual Risk Avoidance Education grantees. And congratulations on your FY 2021 grant awards. If you did not know, just want to share, your projects make up the 4th cohort of competitive SRAE federal grant recipients. And with excitement, we definitely look forward to a successful partnership throughout your 2-year project period. I know you've received a lot of information, significant information that will help you with your projects. So I will certainly be brief with my remarks. I first want to, however, thank our federal staff and contractors for presenting essential information during today's webinar, and would reiterate that they stand ready to provide you with support and assistance as you implement your sexual risk avoidance education projects. On behalf of the APP program, please be reminded that the federal project officers and our contractors are here to support you in accomplishing the overall goal of teaching youth to make healthy decisions as they avoid non-marital sexual activity and other risky behaviors. And we know that is essential to the SRAE program, and Letitia has provided you with all of those critical elements that were outlined in the legislation, as well as the notice of funding opportunity. We know that there may be challenges along the way with implementing your projects. We're still in the midst of a pandemic, and it is having some impact on our work. However, we do know that with open and transparent communication, innovation, creativity, and our cooperative nature of how we communicate, cooperation in general will lead to inevitable accomplishment of the goals of competitive SRAE. So this accomplishment of goals and success is also contingent upon your partners, your contractors, and subrecipients. So I encourage you to invite your partners to participate in all relevant training and technical assistance sessions that will be made available to you. Jerry Regier has spoken about some of those, as well as Mathematica and other contractors, some of the supports and training sessions that will be made available to you. So again, take advantage of those resources and the information that will be shared, because it certainly will support you, again, with successful program implementation, your data collection efforts, as well as for those of you who are conducting evaluation efforts, it will lend some support in that vein as well. So you're further encouraged to review the recording of today's webinar, as well as to share the recording with all staff affiliated with your project. It's really critical that those staff that are implementing and supporting your project are aware of what's in the Notice of Funding Opportunity announcement, what's in your proposal that was submitted in response to the NOFO, as well as the information that's shared today and the information that will be shared with you in the days to come. Also, I invite you to refer to the grantee guidance document, which has information on how to appropriately manage your grant in alignment with some of the federal requirements and policy and regulations. That guidance document was shared with you by your assigned federal project officer in their introductory email, just congratulating you on your award and informing you that they would be working with you alongside of you in implementing your projects and supporting you with that. And so, again, I said I would be very brief. I do want to share that on this slide, that there is a plethora of resources that are available. We have several websites that you'll find to be useful in the implementation of your projects, from the FISBE website to the exchange that Owen just spoke about, as well as the We Think Twice campaign website. So please, again, utilize those supports and resources. There's no need to recreate the wheel. We have lots of information that you can use for staff training and supporting dissemination of the work that you're doing in your local communities. Again, I just want to say congrats. Thank you for your participation in today's webinar. And at this time, we're going to move forward with the final session for today's webinar, which is question and answer. So at this time, our public strategies partners will moderate the question and answer session, and feel free to insert any questions you have. It looks like we're a little bit over time, so we may only be able to take 1 or 2 questions, and after which we would encourage you to reach out to your federal project officer should you need more information. So it looks like Jerry's on. Jerry, any questions thus far?
Yes, thank you, Labrita. There's a couple of questions, and one you already kind of answered. It was about whether the PowerPoint will be posted anywhere, and as Labrita said, it's recorded and it will be posted on the exchange. So it takes about a week or a week and a half to get it in compliance, and then it will be posted. So then the second question is for Bernard from OGC, and someone asked, he had talked about key personnel, and so maybe you could talk, Bernard, about how you define key personnel. That was a question that came up.
Okay, key personnel typically is only applicable to the grantee authorizing official and the principal investigator, project director of the PIPD. So those 2 individuals are the ones that are considered key personnel when making any type of budget modifications and things of that nature. If those there are any changes with those 2 spots, or if they're missing for more than 3 months, those are the times when you need to contact your federal project officer and your grants management specialist to ensure that those changes are made regarding your grant award.
Great, thank you, Bernard. And you see that Julie has put the different links into the chat. And so just for your convenience there, if you can copy those or take a quick snapshot of that. There are no other questions. And as Labrita said, we've gone over slightly. So if you do have other questions, please contact your project officer, and they'll be glad to give you that information.
Thank you, Jerry, and thank you all for attending today. This will conclude today's webinar, and we hope you have a wonderful day.